Ladies and gentlemen, I'll be talking on the challenges in the management of a child with trisomy 21, a doctor's perspective of what I have faced in the last 21 years. As an overview, I'll be talking about the challenges that I had in the diagnosis, the investigations, counseling of the patient, challenges in management, societal challenges, behavioral challenges, vocational issues, and challenges in general. The diagnostic challenges. Diagnosis usually by Gestalt. By Gestalt, we mean we look at the face of a child or overall at a child, and then we make a diagnosis that this is a case of Down syndrome. Though there are a lot of points like upward slant of the eyes, the low set ears, depressed nasal bridge, we don't look into each of these points to say this could be a case of Down syndrome. Just one look is enough, and experienced people can make a diagnosis of Down syndrome by Gestalt. But the confirmation is by karyotyping, because by Gestalt you could be wrong. As in this case, you've got two children almost similar looking, but one on the left is a child with Down syndrome, and on the right is a normal child, perfectly normal child. So Gestalt could vary depending on the experience on the person who makes a diagnosis. Now, karyotyping, otherwise known as cytogenetic analysis. The question is, why do you want to do a karyotyping if you're diagnosed by Gestalt? I face these problems a lot of times because when I ask the patients to get a karyotyping done, their GP tells them, well, you don't have to spend money on karyotyping because the diagnosis is certain for me. Tell Dr. Shaji that this is a case of Down syndrome and don't waste your time and money on doing a karyotyping. So then I had to convince them why it is being done. I too can make a diagnosis of Down syndrome by just looking at it, but then I have to confirm before I go in for a further counseling and further test. So confirmation is necessary. Sometimes, very rarely, a normal looking child may turn out to be a child with Down syndrome because they have only minimal features of it. Could be a mosaic Down. And what you are seeing in the picture here, as somebody who had most of the features, is perfectly normal. So then you have to convince them, and then you will tell them that the cytogenetic analysis is not merely for confirmation. It is absolutely essential for your future pregnancy and for predicting how it is going to be. So karyotyping is mandatory. It is being done normally all over the world, but then we have challenges in getting it done. The initial counseling. Now, the question is, why an initial counseling? Well, the moment you feel that there is a possibility of a change, a chromosomal abnormality, is essential that you should counsel the parents, because if you wait for the karyotyping results and other results to come, then it may be pretty late. The mother may not turn up for a review to you for a counseling, or they may just forget the whole issue and then come to know much later when there's a development delay or any other problem that they have a child with Down syndrome. And then precious time is lost for early intervention. So it's absolutely essential when you're suspecting it, tell them you're suspecting something, that you need to follow up. Don't tell them straight away it's Down syndrome, but tell them there are a few facial features that could be different. So we're sending a test for you, and then we're going to follow up for that. But then how do you counsel? A mother with great expectations have delivered a child. And then you can't go and point blank tell them, look here, you have a child with Down syndrome. Doing that in a busy practice is very, very uh, difficult. And then you got to see that the parents are comfortable. You got to talk to both the parents ideally, see that they are seated and tell them the positive sides first, and then only talk to them about the negative sides. But then usually there is denial. So when you do it, as I mentioned, at your first contact, the moment you see the child, whether it's at birth or at a later period, when the child comes to immunization, that is when you don't have to waste any further time. By whom? Definitely by the doctor who is treating. The pediatrician or a neonatologist, or even the obstetrician who took the delivery, because they'll have more faith in them rather than a new doctor coming and telling something about all those things. So it should be done by the doctor who has seen the patient and in whom the patient has reposed his confidence. To whom? Now, this is a big issue, at least in my part of the country, because ideally, as I mentioned, both the parents should be counseled together. But here the problem is the mother's parents will come and tell you, you can tell the problem to us. We know that there is some problem. Don't tell the father or the father's people. A very tricky situation. You ask them why. Well, if the father comes to know that there is a problem, he will leave his wife, that's my daughter, and then there will be family issues. Their family will start criticizing our daughter. That's because of my daughter that we have a child with Down syndrome. So we will gradually tell them. So don't include the father, but then only tell us. As I mentioned, it's a tricky situation because you can't hide something from the one paternal side and then talk only to the maternal side. And what usually happens is the mother's parents never tell it to anybody, not even to any of their relatives. Now, if we regarding investigations, why do you go in for investigations? There are associated conditions like cardiac defects, hypothyroidism is quite common, hearing impairment alone or hearing impairment can contribute to the delayed speech. There are various other medical problems like gastrointestinal problems and a need for future pregnancy counseling. So investigations are mandatory to rule out other associated conditions which are normally seen in children with Down syndrome. And after you get all these results, then going for a definitive counseling. When you're fully armed with what's the status of the child, after confirmation. But here, as I mentioned, you should be telling the positive things first and then mention, okay, your child also has a small cardiac problem, but then in 60% of the cases, you do have a cardiac problem. So then maybe we can tide over it. Be patient with the family. That is what many doctors don't have the time, especially in a developing country where a large number of patients are there. Answer all the questions. They'll be having a lot of questions. Be patient to answer all their questions because it may be difficult for them to accept that they have a child with a problem. And don't keep any time limit when you're talking to them. I normally tell at least 1 hour because that's the time when you tell them the problem and then the time when they ask all the questions and then take your time to reply. Now this is a problem in developing nations, especially in India and in Kerala where I come from. Because on an average, a doctor in the government sector sees about 80 to 120 patients per day. There's no exaggeration. There's 80 to 120 per day. And in a private hospital like the place where I work, it's about 40 to 60 per day. So with so much of workload, unless you specifically allot time to talk with them, you may be doing only half the job, and that can create more problems. And the management, we all know it's a multi-specialty management. You have the pediatrician or the physician with the older child, the ENT surgeon, the ophthalmologist, cardiologist, orthopedician, dental surgeon, and a genetic counselor. And the therapist, you have the physical therapist, occupational therapist, speech therapist, behavior therapist, clinical psychologist. Of course, there should be a social worker and a support group. So it's a combined effect of all these groups, departments, and specialists when you're managing a child with Down syndrome and other similar conditions. I mentioned about early intervention. Now the question is, how early? Some people believe it's the moment you see the child. If it's at birth, started at, because the mother is the first therapist. Inform the mother as to what is being done, how to handle it, your tactile stimulation, your speech stimulation, eye contact. Some people say at least by the 3rd month, you should have started an early stimulation if you have missed it in the first part. But it can also happen that they have missed it totally and they come to you at the age of 1 year. And at that time, don't waste time, start the therapy. But they don't criticize them saying, oh, if you had come earlier, we could have done something. Don't give them a guilt complex. So early is how early? As soon as you see the child. My greatest challenge is a sustained interventional programs. You're all happy when you say that something can be done. And we tell them, talk to them about physical therapy, occupational therapy, speech stimulation, all those things. Very stimulated, very motivated parents. But at the end of 6 months to 1 year, I find that many of them have gone back. There are various excuses to say. Well, there was a death in the family, there was a marriage in the family, my elder child had his exams, so we are concentrating on that. Or, well, initially we had some improvement, but later on it's remaining stagnant. So we thought that is enough. Or my child has started talking now, so I don't think there's any need further for that. But you tell them to take a medicine for 5 years, they will religiously take it. But as far as therapies are concerned, very difficult. I have to keep on telling them why we need to take the therapy. That's the greatest challenge that I have. Treatment shopping is another problem. There are people who comment, their relatives or maybe their friends, why don't you show to a good pediatrician? I can suggest a few names. In fact, I have a child with Down syndrome, and this question is asked to my wife. Why don't you show to a good pediatrician? I can suggest a few names. My wife didn't know what to answer. She didn't know whether she should tell the person that her husband is a pediatrician. Why don't you show to Dr. X? My son started talking after showing it to him. It's an alternate system of medicine and totally safe. People believe that the alternate systems of medicine are totally safe. So this is a problem. Or is it because of denial? Or is it because of frustration that they go around? Maybe because it's comments we doctors do make it at times that there's no cure. When you say there's no cure to revert the trisomy and bring it to 2 chromosomes. But the way we say it, without casually, they get the impression that nothing can be done for this child. Well, if the modern medicine people can do nothing, then why not go for alternative systems? I have no objection to that, but then I have seen people being swindled because of the alternate systems and running from one doctor to another doctor without consistently going for any regular therapy. Facing the society is another big challenge. Unlike the West, where people are not too much inclined to be inquisitive about each other, here in our society, where I come from, people are being nice, so to say. So if you're seeing somebody after a long time, you say, oh my God, you have put on weight. Are you okay? Or you say, you have lost a lot of weight. I hope you don't have any illness. You have become very fair, or your complexion is darkened. What is it? What happened? So this is the nature of the society in my place. Now, if you don't say anything, that means the person is not interested. There's a way of dealing with people. It's a part of the culture there, and they don't mean anything. But then when you have a child with Down syndrome and it's taken into for a marriage party or a get together, then is a problem. Why is it that he has not started walking? A reasonable question. The mother knows that. But when somebody asks that, the mother has a difficult time. Why is his speech not clear? And more difficult, is your child retarded? A very difficult question. We don't use the term retarded at all, but this is what the layman tells the mother. It can be staring looks, inquisitive looks, or sympathetic looks. I have had mothers who have started crying after taking the child, because we tell them, take the child wherever you go, let the child be exposed. But then the mothers start crying after coming back from such occasions. So what I tell them is, you've got to take the child out, but be prepared that in our culture, people will ask something. If they don't ask something, there's a problem. So be prepared to face it. Okay, not started walking. Yes, my child has not started, but I'm giving the right therapy for it. He'll start walking shortly. So if you have that mental framework, then it won't be too much of a problem. Behavioral challenges, like any other so-called normal child, there can be mood variations as they grow. There can be depression, anxiety, sorrow, tantrums, a lot of other things. But then we could understand these children also do have these things. In early times, people believed that intellectually impaired children don't have emotions because they're impaired. Even the emotions are impaired. But no, they really do have all the emotions that we have. And so we got to take care of that. Educational challenges, special school versus normal school. To send the child to a special school, or is it to a normal school? To convince the mother, the parents, to say that you take your child to a normal school and only then the child is going to improve. And once you achieve that, then the next question is whether schools are going to take the child. Many of the schools don't accept children with intellectual disability for the simple reason that it could be that their results, a good school which has been having a 100% result for the last 10 years, all of it suddenly you have children with intellectual impairment, and maybe a year somebody may not get through, and it will affect the reputation of the school. That could be there. I had so many children who were rejected, but now in the state of Kerala, or even in India, it's compulsory that you cannot deny admission to any child with whatever handicap if taken before the age of 10 years to the first standard. If somebody says so, just give a complaint and the government takes care of the rest. Lack of supportive teachers in the school itself. A normal teacher would have to spend some more little time with them. And they're not interested because they've got their own work. So that again is a problem. And complaint of other parents in a normal school. I had an occasion when the mother came to me and said, Doctor, I'm not going to send the child anymore because the parents of some other children made a complaint to the principal and the headmaster stating that we don't want to send our children to a school where there are idiots studying. How much it pained the mother, you can understand. I said, no, you got to face up, put your foot down and say, no, don't be afraid of what an ignorant parent of a so-called normal child has said. It's our duty to educate them. Let's have a meeting. I'll talk to them. Vocational guidance, can they work? It's a fair enough question, but many of the people now believe that they can work because they've got a large number of children who are working now in our place. Can they work in a group or independently? Definitely group, but they too can do it independently. I have children, grown up, going on their own, catching a bus to the workplace and coming back in the evening after the work, totally independent. So they can be trained to be independent. Can they take care of themselves? Of course, they can take care of themselves. How will the society view them? Would they be ridiculed? Well, this is something which I have an experience of a mother who was in Chennai. She sent her son, well trained, to a supermarket. His job was to pack all the food items or whatever the customers had bought, a nice packet, and then give a good sweet smile and hand it over. It went on very well. But at times there are customers who stare at them, I should say, uh, very hurtingly, as if there's some alien creatures who are standing there. Unfortunately, on one such occasion, the child's mother came over and saw people staring at his child, which she just couldn't tolerate. She immediately said, "No more of your work, I'm taking you back." She said, "It was the greatest insult I had." So this is again a societal view and vocational guidance. So this is something which you got to think about and address. So what can we as advocates and doctors do? The best thing what I have found out is form a support group of parents and caretakers to support the parents. Because when a doctor, even though I am a father of a child with Down syndrome, I tell them, they feel that I'm trying to pacify them. But in a support group, I've seen that when somebody comes up with a problem and somebody else says, "Oh, my child had this problem, he has started walking very well now," then that gives some confidence. So support group is absolutely essential for parents to educate the public. Well, they should know that they are normal human beings with an extra chromosome, and they can do things well or even better than most of the so-called normal children. And to update doctors, as I mentioned earlier, doctors are missing. Maybe earlier days, the proper way of counseling was not taught to them. So in the busy practice, they must have missed something. So we could update the doctors stating that, see, you can't afford to miss a child with Down syndrome, because the, that if you don't diagnose it early, you are losing precious early intervention time. Now, how do you form a support group? This is something which people used to ask me, so that I just thought I'll tell it here. Get a list of the children in your area whom you have been seeing or with Down syndrome. Call their parents and have a meeting. And after that, have a regular meeting. Once a month is what we do. We have a meeting on every second Sunday from 3 p.m. to 5 p.m. for the last 21 years. This November, we have completed 21 years. And it's a convenient place where they all can come and go, provide tea and snacks, if possible, or even better. Elect a president and secretary, and then form a support group committee. Have a speaker. Initially, you can coordinate the speakers, maybe an external speaker, a medical expert or a therapist, to tell them what it is. Or it could be a discussion. One of the parents can tell up and say, "Okay, this is my experience. I want to share this experience so that others will be benefited." Or it could be somebody from the government department who can tell them about the facilities available, the rights. So you can have different people, and then ultimately this goes off very well. It automatically takes off. And then some of the parents have told me the best thing that has happened to our life is coming into the support group, because that gives us immense satisfaction and immense relaxation, knowing that we can do something for them. So, ladies and gentlemen, let's celebrate Down Syndrome Awareness Month we had last month, and we have the World Down Syndrome Day. And any chance to enlighten the society, we should make use, so that the society will understand, okay, these children can gel very well with the society, and they have to embrace them with an open heart. So till that time, or even later, we got to continue telling them, we got to celebrate. And people should ask, why are you celebrating? Okay, this is the reason, and that's the way to go forward. Thank you. Thank you very much.